everyone, it's Mariana and I'm back with another great interview. If you are new here on this channel, I interview the brightest minds of physical therapy, and if you want to improve your patient care and be a successful physical therapist, start right now by subscribing to this channel and clicking on the bell so you don't miss anything. And please share this video with people that you think you would also benefit from learning from the best PTs out there, and give us a thumbs up. With you now, the Dr. Edelberto interview. Enjoy! Welcome to PT Pro Talk, Dr. Edelberto. How are you feeling today?
I'm fine, thank you, Mariana. Thank you for your invitation. I'm happy to be here.
I'm very glad that you are here with us today. Thank you for accepting my invitation. So, Dr. Edelberto, could you tell us a little bit about yourself, your career, and how you got involved with Maitland?
Certainly, Mariana. I'm Edelberto Marques, a Brazilian physiotherapist, graduated in 1994. I've been working with manual therapy since my graduation, or 26 years of professional life. In 1995, I have the opportunity to bring Professor Cummings from the Georgia University to Brazil. He was a physiotherapist and a master degree in connective tissue. And he was also a teacher of Maitland Concept. In 1995, I took my first international Mulligan course in Milwaukee, St. Louis. For us, it was a new course that was unknown here in Brazil. In 2000, another friend, Palmiro, and I, we took the test for the Mulligan Concept teacher, and we became the first two teachers with international accreditation of the Mulligan Concept for South America. In 2003, I finished my osteopathic course, and 2007, I concluded the postgraduate course in Acupuncture. And as soon as I finished the course, I went to Beijing, at the University of Beijing, to do a mini-residency. And finally, in 2008, I defended a doctoral thesis at the University of Buenos Aires. I developed a treatment protocol for degenerative meniscal injuries. So I got involved with Maitland's concept from the first course in 1995. And because in addition to be a student, I was also a translator of this course. And I continue to be translator and assistant in other courses around Brazil. And 2002 and 2003, I have the news that our friend Gordon Cummings passed away. Gordon was a person that I had as a reference, as a human being, and as he taught the art of manual therapy for us. What I do today has a lot of these teachings.
Nice, that's very nice. A lot of experience. I heard about Maitland, Mulligan. I know you are also a Mulligan instructor.
Yes.
The first one with Palmiro in Brazil. So I think that's awesome. And also I heard about acupuncture in China, Doctorate, osteopathic, that I think here in US, it's a little maybe odd for people because we know that here physical therapists are not allowed to practice osteopathic. So just to make clear for everybody that is listening to us, in Brazil, physical therapists are allowed to do the specialization. I did as well. So I think it's a very beneficial technique that we are allowed to use in Brazil that we are not allowed to use here. So that's very impressive, Dr. Edelberto. A long career, long path, a lot of different courses and experience. I'm sure you have a lot to add here to teach us, and I'm very grateful that you accept also the challenging of being here, speaking in English.
Yes.
So yeah, I really appreciate that.
Yes.
So
it's very important to note, Marian, that I was taking those courses along of my career because I was very the necessity to treat patients. So I never took a course because the name of the course. I took the course because I was not prepared to treat patients. So I tried to find new techniques to have the most techniques for my patients. That's the reason I took those courses.
Yeah, so that I think that is everything. We just have to be seeking for more knowledge so we can offer a better care for our patient. And I think that's all about. It's not like one technique, but you are able to treat the different scenarios, the different patients that come in. So I think having this ability, and you're also developing your analysis, your assessment, so you can identify which patient is going to fit with that technique, which patient is going to be better with that other.
Yes, that's the point.
So yeah, I think that's great. I think yeah, I'm really impressed. Moving forward, when did you begin teaching Maitland, and what caused your attraction specifically to Maitland?
Well, I started teaching Maitland's course in Brazil in 2005. The first name was called mini-residency Maitland's Concept, the same title that Professor Gordon Cummings brought to Brazil. After his death, we had no one who taught in Brazil. And at some point, some friend asked me, why don't you teach Maitland's Concept? So I thought, well, could be a good idea. So after 10 years working with patients, practicing the concept, I started teaching the Maitland's Concept this day. And what makes me the attraction to Maitland? Well, the Maitland's Concept was for me an awakening on new knowledge, because I was very lucky to study this concept as soon as I was graduated from college. I don't know what the teaching model is at American Physiotherapy College, but here in Brazil, the model that they teach us at the college is a biomedical model. In other words, when we left college, we are neither physiotherapists and nor doctors, because we only learn to deal with ready-made protocols of beautiful names, such as bursitis, tendinitis, etc. Only pathological names. In my point of view, patients are not seen holistically, only segmented in this kind of model, in biomedical model. So when I started to study the Maitland's Concept, that was still in college, I bought the first book, Maitland's Vertical Multiplication, 5th issue, I never forget. And I saw that there was another world outside that one I was living in. I put in my head at that moment that it was what I want to my professional life. Oh, this is I try to follow this. So the Maitland's Concept provides us with broad view of new ideas and what's important for me, freedom of thought. There are no protocols that attract me to continue practicing this concept until this day.
Yeah, that's nice. And I think not having protocols, it's nice because allow you to think with an open mind about everything, so you're not stuck on that technique and needs to be like this. That is how you have to execute the technique, and and I think assessment is very important, because that having a good assessment, we already talked about this on this podcast, that changed the whole approach, the whole treatment, because if you can assess, you can treat. So having this open mind and not having protocols for sure helps you to develop your thinking process. And also this approach that is more holistic, you see the body as a whole, comparing to just looking at different segments. I think that's great than just learning very specifically each technique and at each segment. So I think that's very valuable.
That's the reason that we work in private clinic, and we treat just one patient each time, not a group of patients. So that's the reason That's the reason our profession treats one patient at each time and not a group of patients.
Mm-hmm.
So we need to know this kind of assessment and the specific treatment for each patient, not protocols.
And that develop us as physical therapists. And we are talking about before here about this topic as well. Here I see a lot of big clinics, and I think in Brazil having one-on-one treatment is more common than here that we have. It's all about insurance and all about money, that we have to see patients as groups. So I feel lucky that I could see patients one-on-one since I graduated, and I can develop my thinking and my way of assessing and treating. And you can test some things and see how it works and what works. Yes. So you become a better physical therapist than just having to give exercises to groups, and you can spend a lot of time with each individual patient to really understand what's happening to them. So I think that makes all the difference in the world.
For sure.
Okay, so we are talking here about Maitland, so I'm sure some people never heard about it or don't know exactly how Maitland works. So could you define Maitland and its indications and benefits?
Sure. Of course, it's my own definition. It's not from the book. The Maitland concept for me is a kind of philosophy of knowing how to think and act. It's a kind of concept that started in 1950 in Australia by a physical therapist named called Geoff Douglas Maitland. He was considered one of the most brilliant physiotherapists due to his way of thinking, which was advanced for that time and the time he lived. The important point of view, we have to see how the concept works. The Maitland concept is based on clinical assessment. It's divided in two parts, important parts, a subjective exam and objective exam. A kind of diagnosis he called the comparable signal. A specific point they call decision-making. A treatment that's divided in 5 grades of treatment, and analytical assessment, and home exercise. The clinical assessment is based on clinical reasoning. Moreover, clinical reasoning is found in all times of the concept. So, the thought process would be the whole assessment process until determining the physiotherapeutic diagnosis, which he called comparable signal. The act would be the application of the best technique selected for the evaluated patient. Talking about indication, we could say that same for orthopedic trauma physical therapy. Signs and symptoms involve neuromusculoskeletal system, the main signs symptoms involved. For me, the great benefit is being able to make less mistakes with this assessment system and to control the application of the technique with the analytical assessment. That's the resume of the definition of the Maitland's concept.
Mm-hmm. And I think it goes back again to assessment. So I see from what you're saying that is a lot about assessment and the clinical reasoning and thinking to be able to figure out what's happening with the patient that we are treating, not the specific body part we're treating. So I think that's very interesting, this Maitland approach. And again, it comes from Australia. What a great place to be on the last century.
Most of the manual therapies that you know today comes from Australia and New Zealand.
yeah, that's a very special place, I would say.
Very special, yes. We talked about this kind of subject. If you open the Maitland's book, you're gonna see more than a half of the book is talking about assessments, or a most of theory, a philosophy. He dedicated uh, a few pages for treatments. It's not a concept for techniques, only techniques. Most of for how you can interview the patient, how can achieve
I can assess, right? Like how, yeah.
You can find the cause of the problem of the patient. That's the reason.
That's the main point.
This whole assessment. Okay.
Yeah, that's great. And again, I can't stress enough how I believe that's what we should focus on providing a good assessment and understanding what's happening to our patient, and just jumping right to the treatment, trying to fix something that we don't really know what is the cause of that problem. So
what's happening? What's behind of this pain, or the symptoms, the patient symptoms?
Right. Exactly, there are just symptoms, right? They doesn't mean that because you feel pain on your shoulder is because something is going on with your shoulder. We should see where it's coming from. You know. Yeah. Okay. So now, I'm sure you had great outcomes using the Maitland approach, but do you have any remarkable outcome using Maitland that you would like to tell us about?
Yes, I have one case, and I'll talk about her. I have several good results, and almost 26 years working with this concept, the others concept, of course, but that's my cornerstone of the assessment cornerstone. As I said earlier, this concept has its indication for neuromusculoskeletal problems. Okay. However, the application is much more than this. I always try to follow some Maitland's orientation, and you can see in some pages of this book. If you think about when a patient comes to us with any symptoms, and usually he comes in pain, that's the point. The first question we should ask: what's the cause of this pain? As you said just now. Because if you don't ask that question, you go treat the pain site, we're certainly not treating the cause of the problem, the patient problem. That's why the assessment, the subjective exam, is the most important item. We had 2 days before an interview that we talked here in Brazil about the subject exams, only that. It was an hour and a half talking about this theme. It was very, very amazing. Many things to talk about, just one item, subject exam.
Yeah.
It's very important. It's very important to find out the patient problem. If you think about, we are detective, no? Could I say detective?
Yeah. You are investigating what's going on with the patient.
Yes.
You gotta have all the tools and everything that you can think and our experience to try to figure out what's going on. I think that's our goal.
So in this kind of exam, subjective exam, we find out the patient profile and we go through the assessment. And in this assessment, we have some questions, important questions to ask the patient. The first, of course, the main complaint. Why do you come here? What's your problem? How it happens? Injury mechanism. It's very important. If it has a mechanical trauma. Clinical history is very important to ask all of things for the patient. Behavior of the symptoms in 24 hours period. What happened in the last 24 hours? How do you wake up? How to go to sleep? If you wake up at night with pain. So that's an important question. There is a topic called special question and complementary exams. You see, complementary exams, when you check X-ray, RMI, etc., it's the last topic. It's not the first. Some colleagues, when a patient comes in his clinics, the first thing they see is the X-ray. What's the reason to see X-ray the first time? There's no reason, all right? So the special question part is a time to check if the patient has any red or yellow flags. Just to divide, to share the patient where he goes, to the mechanical direction or the organic or systemic or metabolic direction. Because if it goes to this kind of problems, certainly you have to send this patient to the medical investigation. Okay. We have. I'll talk about on a patient that I had. I think for me what's the most important patient that I treat with this concept. She was a female patient, a 15 years old patient. She comes to me with low back pain for 30 years, and she had been treated by several doctors and physiotherapists, but the pain never disappeared, never go away. During the assessment, I asked myself, how can a person stay 30 years with a low back pain? And I started the subjective evaluation. Some items, when we are in this part of the assessment, we usually mark with asterisk or any other symbol you wish to identify if something is very important, not to forget. I remember that I marked she had a gynecological change. She had a myoma at 30 years old. Coincidence? 30 years old with low back pain and 30 years old with myoma. And to use a Mirena. Mirena is a kind of intrauterine device. Already 6 years old encapsulate, which would normally be removed the maximum 5 years of use. There's two important points that I found in this patient. Second, I usually ask the patient to bring to me blood tests. It's very important to check how the chemical process is in those patients. She had abnormal blood tests, many red and white cells, and TSH problems. At the end of the investigation, I talked to her and advised her to find a new gynecologist. She accepted promptly. The consultation with the gynecologist specialized in fibroids was carried out, and he immediately suggested a surgery for remove the fibroids in Mirena. The post-op result was the 30 years old pain went away, and the patient said to me, the patient words, my pain disappeared as it had been taken away with magic. So you see, in this context of the patient, a good evaluation could reach the cause of the patient problem. That's not necessarily be a musculoskeletal. It can be any other cause. In this patient, there was no education for treatment with the physical therapy techniques. That's I never taught her with any technique. I just talked to her, and I just stayed in the subjective exam.
Yeah.
And you see, if it had been done a good medical evaluation, certainly this patient wouldn't have had the pain for 30 years. So there was an amazing case that I had of this patient.
I think that's a good example of how important it is to be trained to perform a good assessment and identify the flags, the red flags that are so so important to let us know if you're assessing, if you're facing a mechanical problem or not. Because if it's not mechanical, we can treat them.
Yes,
so
of course.
So and I think so then you're able to tell the patient, I can help you. That's what you need to do, and then you refer the patient to the doctor, to go back to the doctor, or to do whatever you think that is appropriate in that case. And I think that's incredible, because it looks simple, but it's not, because this patient passed through so many doctors, so many healthcare professionals in her 30 years of pain. So I think having the ability to identify these patients that we cannot help and you cannot treat because they're not mechanical, that's right there is the importance of having a good assessment skills and being trained on an approach or in a system that allows you to screen the patient in the correct way and look for these specific signs and clues that we have on the subjective exam to allow us to help this patient, right?
Yeah. The Maitland's resume what you said, clinical reasoning.
Yeah.
It's the amount of knowledge that you acquire along your life, studying, right? Taking courses, reading papers. That's it.
Yeah. That's how we develop our skills. And I think that's and that should be our goal, be able to identify what's going on with our patient and help them. We are there to help our patients to deal with their problems, and you have to be trained and you have this ability to do that.
Yeah. I don't know, in a nice state has the figure of a primary care?
Yeah, the primary care physician.
Yes. It's a physician, or it could be a physical therapist. I think in Australia, physical therapist could be a primary care. I don't know.
Yeah, the person with the first contact with the patient. So here it depends on the state. Each state has different rules and regulations. Some states, the patient can go straight to the physical therapist and be assessed and treat. Other states, they have like partial direct access that we call. The patients can go straight to the physical therapist, but at some point in a specific number of visits or time, they have to have the doctor's referral to continue the treatment. And in some states, they don't have any direct access. You have to have the doctor's referral, so the patient needs to pass through the doctor first.
Okay. In Brazil, officially, you don't have this kind of primary care, but most patients looking for an old and a good physical therapist, because unfortunately you don't have the most of the medical physician diagnosis is not very good. We just found diagnosis from images, X-ray, MRI, and the whole medical evaluation is not being done here.
So so I think assessing functionally the patient is the key, and that's why a lot of these approaches, they always say, like, don't worry too much about the image, the X-ray, the MRI. You have to see this patient moving, and first you have to have a good assessment and screen this patient. And then if you believe that's mechanical and it doesn't have any red flags, you have to move this patient and understand what's happening, and not
green lights. Okay, go through.
And if you see something on the MRI, for example, it doesn't mean that the patient, because he has some disc protrusion or some hernia on his back, it doesn't mean that he's going to have pain because of that, and vice versa. So we have a lot of studies showing that people that have problems, they don't have symptoms, and some people that have pain, the exam doesn't show anything. So it's not like it's not something that is certain. So I think most important is our physical exam, and so many doctors, clinicians, even physical therapists are not trained to do this functional exam. So I think that after the assessment, that's the other very important point, that we should be trained as physical therapists to be able to perform correctly And again, being the main point, trying to understand what's going on with the patient through tests, right?
Yes.
So that's what we as physical therapists should do.
Right. Perfect.
Moving on with Maitland, could you talk about Maitland's strengths and weaknesses?
Okay. Well, we assume that all techniques are good, are excellent, and each one has its particularity for the person who analyzes it. Each has its applicability, that is, each has its direction for a specific structure of the human body. The matrix concept, it's important to know, is not a concept of techniques. It is much more than this. It's a concept developing clinical reasoning through a methodical process of subjective and objective evaluation or assessment to determine the cause of the patient problem. So, assessment would be a quality of strength, and the analytical evaluation or assessment is another strength because it controls the application of the technique and immediately evaluates the comparable signal. Thus, the result is observed if it was positive, negative, or without change. I'll give you a very simple example. Let's say the patient says that when climbing the stair, he feels pain in his knee. Could be an infrapatellar pain. Thus, my attention is on the angle of the knee when the pain starts, where the pain is, and what percent of the pain is on the pain scale. That's I write down. That's what we call the comparative signal for these patients. So I have to have some reference to treat my patient. So I apply the technique, no matter what techniques now, and immediately reevaluate the comparative signal and check if the result is better, if it is worse, or not change. That's we could say that's the most strength part of the matrix concept. Weakness could be the treatment, as it's a concept that uses passive accessory oscillatory techniques or manipulation. It's had seen low in scientific evidence, a low evidence for some authors when we apply manual therapy techniques.
Yeah, so I think it goes back again to the assessment that we talked about. So
Yeah.
that's one of the strengths. So we already talked about the importance of being able to perform a good assessment, and I think having as many options, approaches, and techniques as we can is just gonna be beneficial for the patient because they're going to be able to solve the different situations. So now I just have one more question on this first part. So what does the future look like for you, Dr. Edelberto?
For me, I think, I don't know, most of the colleagues, the virus situation will happen worldwide. I think things just don't just happen. They have a reason to happen. The worldwide situation of the virus will bring changes in all areas of human life, I think. And the area of physiotherapy is already shown that the repercussion, the importance of the process of helping in respiratory rehabilitation. This has a ripple effect with the repercussion on other specialties in our profession. The virus only came to enforce the importance of our work in the rehabilitation process, and it doesn't matter which area. Thus, I see a very promising future, great credibility for the population, and especially for doctors. I don't know what happened in the United States, but in Brazil, most of the we have some special doctor specialties. They don't care much for physical therapists. I think it is what happened worldwide or the virus. Those thoughts will be changed.
Mm-hmm. Yeah. So one difference again that we have between US and Brazil is here we have some respiratory therapists that do this part more specifically. In Brazil, the physical therapists are also trained to do the respiratory treatment and part of the hospitals. So just for people that are listening to us, they understand that we have some difference right there. But in a whole, I believe that we are becoming more and more important as therapists to treat the patient as a whole in all the areas that they need us, especially on this crisis. A lot of people in pain and all the consequences of being sick, and even people that are not sick, they stay at home, they start to getting more neck pain, back pain, and we are seeing a lot of people looking for us. And another side of this whole crisis that I think it's leading us is to the telehealth. That's another new trend that is coming. So I think we therapists that are trained to assess the patient properly, it doesn't change if you're assessing in person on the subjective part, in person or in telehealth, you are still going to ask that specific questions, the important questions to assess the patient. So I agree with you, and I believe that our importance as therapists is just going to increase more and more due to this whole crisis that the world is living, and especially the ones that are trained to help the patient with a good assessment, and probably not as hands-on therapy as
the importance of our work to help the patient's life. That's the main point, right? From now, I think from now on, they will try to looking for more physical therapies to prevent lesions. I think that that the focus of the health, prevention. That one you use to treat disease and not prevention. That's the point, the very important point.
Yeah, we should be switching to prevention, but most people are not very interested in preventing. But we hope that the scenario will change soon. That's what we hope, right?
Yeah.
Okay, Dr. Edelberto, as we transition to the end here, I have 3 questions that I want to ask you. And the first one is, what is your favorite physical therapy related book or source of information? It could be any article, any paper, or any study as well that you like as a source of information, like as something that you would research and look for.
Yeah, I don't have a favorite books. I used to have and research books on clinical anatomy. It's very important for us, physical therapists. Assessing models. I try to compose ideas. Also, I'm always update on scientific articles related to clinical anatomy and vagus nerves or autonomic nervous system. I'm developing a kind of protocol, a treatment that goes through vagus nerves and autonomic nervous system. And headaches is a point that I like to study, and we have a group in Brazil that we treat only headaches. And I do update every 6 months on PubMed and Pedro. But I have to mention 3 books that made me to think better about physiotherapy. The first books, Maitland books, of course. It showed me the art of thinking. It's very important, how to think. A clinical reason to join all the information and decision making. What I do with all those informations, that's very important. The second book, it's a Mulligan books. It presents all the simplicity that the techniques are easier than we think. The most of the time, we complicate the techniques. And the third book, that books advice for all my students. A differential diagnosis book for physiotherapists from Goodman Snyder's, if I'm not forgot. It's a kind of book that opened my mind that from those causes other than musculoskeletal. So it's a kind of book that brings to us the clinical sources that goes to the musculoskeletal pain. That's the three books that I used to go to see once in a while.
Okay, they're all very good tips. Thank you, Dr. Edelberto. Second question, what would be advice you would give to someone, to a clinician that is starting their careers now?
My advice is very simple. Try to follow what you learn at the college. Try to follow a good professional. Always try to have a reference to a good professional. When I started as a physical therapist, I had two persons that I followed. One of the greatest physical therapists in Brazil. He used to treat knee, called José Roberto Prado Jr. I learned a lot with him because at that time I had we didn't have any kind of access of information, and he had, and we tried to follow him, following his approaches of the patient, how he assessed the patient. And the second person that I followed was Palmiro, is my friend. What I learned from him, the studies. It's a kind of physical therapist that always reads one paper each day. Each day he reads one kind of paper. So if I join those guys, I start my professional life. So studying, working a lot, and try to do courses. Of course, as I said, I never took a course just because the name of the course. I took a course because I achieved a point when I was treating the patient that I couldn't treat the patient. So I felt the necessity to have more information, more tools to help the patient. That's what I did along my career. That's my advice for whom is starting the physical therapy nowadays.
Yeah, that's great. So we should be around people that we look up to, that we know that they do a good job, and being around these people help us. They inspire us to be better and to learn from them. So I think that's important. Be close and be always, as you said, following these people that you admire, that you look up to, follow their steps, and try to learn from them to become better. So you see what they are doing, that why they are so good. I'm gonna try to do the same. I know Palmiro as well, and he's always studying. He's always like reading.
Do you know José Roberto Prado Jr.?
Yeah, I heard about him. So being around these people that inspire us, I think that's great, because you are trying to do something to become one day like them. So that makes us better. And of course, being always seeking for knowledge, seeking for courses, trying to improve your skills and your abilities. So I think that's all very, very valuable.
There is I don't know what you call the right name. Tell me whom you are. You are, né? Tell me who you are. I know who you are.
And I'll tell you. Yeah, I know what you're trying to say. I don't know in English, but it's like, tell me with who you are, and I'll tell you. I don't know how to translate that, but it's like you become. They say something here like you become like the 5 people that you are most around with. So you kind of like that these persons that are close to you, that are around you, they kind of change the way you are. You become a little more like them with the people
Yes.
that you have the most contact. So be around people that are good. You're gonna become good, right?
Yes.
Summarizing everything. That's what we're trying to say.
Right.
Be around good people. The chances are you're gonna become a little bit more like them.
Yes, good. Better.
And the last question, what do you think is important to become a successful physical therapist? So what do you think that sets apart successful physical therapists from those who are not?
I think I've talked about a little bit the last question, but success for me is two words: dedication and determination. I used to have to use the Brian's Mulligan's words or phrase. He always put at the ends of his lectures the phrase, never give up, never give up. So what's success? It's simple. Do the best you can, learn, improve. That's it. If you study, work well, learn from your mistakes, and through your mistakes, you correct yourself, not seeing the error as a defeat, but as improvement, then you'll be successful. But the most important word, Mariana, is love. Do everything with your heart. That's what I say for success.
That's a nice thought, and I do agree with you.
Don't be a mechanic. Don't be a robot.
Yeah, don't
be a human being. Use your heart. You treat everybody.
Yeah, do what you love, and then you're going to be good at what you do, right?
Yes, and then success is just a consequence. Success is just a consequence of what you do. Okay, I see some friends that always talking about I have to have to earn let's say 10,000 reais this month. When you think about money, only about money, money is a kind of energy, right? It's a kind of energy. If you think only by money, you don't treat the patient correct. Of course not. But if you go treat the patient and you have your value, you can charge whatever you want. So money is just a consequence, and success is a consequence also. That's what I think about that.
I think the most important thing is caring about the person that is in front of you and trying to truly understand them, listen to them, and try to help them with the best of our abilities and skills. And so I think the key is caring about the others and trying to help and being passionate about what you do. People feel that. People know that you are truly caring and trying to help them with the best of your ability. So I think that makes the whole difference. And also your results. So when you do what you love and you are always trying to be a better therapist, and the patients know that, they feel that, and then money is just a consequence, as you said. So
it's a kind of relationship. if you are in a clinic with your patient, you are two persons. It's a relationship. Então, each one will feel how you in that moment.
Right? Yeah, exactly. So we reached the end, Dr. Edelberto. Thank you so much for taking the time to talking to me today. I know it's hard to do this in another language.
Yeah.
I do it as well. Our first language is Portuguese. So I know since the beginning when you start talking, you were always like, oh, that's like a huge challenge, but I like challenges. Let's go. I'm going to try. I'm going to practice. Yeah. And I appreciate all your dedication and your love for our profession and you being here to share that with us. I'm sure we learn all a lot about it. You have like this great experience and be willing to share that with us. I really appreciate. I can't thank you enough for all your dedication to this episode. And for people that want to know more about your work, where they can find more information about you.
Well, first I would like to thank you for the invitation. It was for me really a barrier to pass away this barrier.
Yeah.
And I could have a chance to talk more about what I know, because unfortunately it's really the language. It's a block for me.
Yeah, it stops us from expressing exactly what we want, right? Yes, to have the right words.
I could say more than what I know about Maitland, about my career, but I think I try to tell or to talk the main points of the Maitland concept. Well, we have my Instagram, Edelberto.Marques. I have on YouTube some videos that's I talk about the vagus nerve. I'm developing for me is a very important study for vagus, the clinical importance or the application of the vagus nerves in the physical therapies, and I'm developing some techniques to treat the patient. Yeah? So I have a lot of research about that, mainly of course, American research for stimulation for nerve vagus. So I got some important points of those articles and try to unify those ideas, and I developed my own idea about nerve vagus. And we have in Brazil a site called Head and Neck Physical Therapy. It's a group of 5 physical therapists that we are developing a new protocol for treatment of headaches in Brazil. So I'm open to ask any question if you any American colleague wish. I'm happy. I'll be happy to help anything I could. Okay.
Good. So you have a lot of great research coming up and big projects, new projects. I've been following you on the head and neck. They send a new article every day. So it's very nice that what the project you're doing. And I think it's a very niche area, headaches, that we don't talk a lot about. So and it's a big population that suffers from headaches. So yes. I think that's very interesting. And also your research about the vagus nerve. So if people are interested in learning more about that and talking to you about that, I'm going to put all the information on the show notes so people can reach out to you if they want to ask you anything or talk to you. So they, I'll put all the...
Yeah, I'm happy to help. Any problem. I'll leave you my registration. You can put down, write down.
Good. So I really appreciate again, Dr. Edelberto. Thank you so much, and I hope you have a good rest of your day.
Okay, thank you, Mariana. Nice to see you.